We've been talking a bit this week about Alzheimer's, what are some things that you can do to prevent it, and now this morning, what you can know should you be given a diagnosis. We are so happy to have back on the show Dr. Nathan Wyatt, a neurologist at Chattanooga Neurology and Associates. Good to have you here this morning.
Thanks for having me.
So we have been watching with the memorial service for Pat Summitt, and it just rekindles the concerns for a lot of people, but it's especially touching for those who currently are either themselves diagnosed or caring for someone who is. So kind of walk us through what families ought to know when they hear that diagnosis for the first time.
Well, I think one crucial piece of information to know right up front is what is the timeline and prognosis. The textbook will tell you this is a 7 to 10 year process of essentially gradual deterioration, although it can move in fits and spurts sometimes. The things that are going to become more problematic as time goes on will be short-term memory issues, of course, but also disability in making appropriate adult-like decisions regarding a wide variety of things: financial decisions, healthcare decisions, decisions on how to express one's emotions, and then even some other curious deteriorations in the brain where patients become physically unable to, or mentally unable to remember how to do physical tasks such as swallowing, speaking, moving parts of their body correctly.
That's so much for a person and a family to have to take in, especially if you're seeing only mild symptoms in the beginning, to even imagine that this is the road you're heading down. So is there a sense of denial in people?
Well, from a pathological standpoint, that mainly comes from the patient. By definition, the patient will become unaware to even recognize the symptoms, and that's where you see some of the behavioral issues come into play later on, wherein someone might be non-compliant with treatment or frankly combative or paranoid, have delusions regarding the diagnosis. Families too can have some denial. And the tasks, or the mountain of tasks that might be there for a family and a patient to accomplish, can be pretty overwhelming.
So I guess for each patient, the timeline is case by case, right? Is there kind of a set standard that within 6 months you're going to see this, within 2 years you're going to see this?
Well, you don't like to put everybody in the same box,
okay,
because not everybody's social structure or family structure is the same. Some people may have very little support, and some people may have a huge family that provides lots of loving care. Clinically, a lot of the same issues are going to arise for every patient, though. So the things to troubleshoot for down the line will be, can this person still drive a car? The answer eventually will become no, even if it's not no immediately. So transportation to and from doctor's appointments and other types of appointments will become necessary. The living situation: what kind of house does this person live in? Do they live by themselves, with other people? Are there lots of stairs in the house? Does the person need nursing care, something more aggressive than the family can provide? So deciding whether or not it's appropriate for the patient to continue living in their home is a question that comes along towards the midpoint of the disease.
And because this is something that you and your fellow partners see day in and day out, you know all of this, but people who are getting the diagnosis for the first time don't. So at the office, do you kind of counsel people and guide them through things that they should know?
Yes. I would say that cognitive impairment, or dementia, if you will, is probably one of the top 2 referral indications that we get at Chattanooga Neurology Associates. So I don't want to say it's scripted, because it's certainly not. Every
right.
situation is a little bit different depending on who's in the room. But even from the moment the diagnosis is made, we're trying to give the patient and the family some important and useful information to help them decide how to address these concerns.
Kind of holding their hand as they go.
Yes, yes, because it is overwhelming.
It is overwhelming. And so then at what point do they begin to get outside help? Once you have the diagnosis, then are they able as a family to begin to get these plans in place? Does it have to reach a certain point?
In general, families are able to tell you when it's time to make the move on some of these things, but I can tell you, even caring for a patient with Alzheimer's in my family, we were chronically about a half step behind. And it's very hard to be proactive and say, all right, mom or dad, we really need to think about how we're going to assist you in making financial decisions. And maybe there could be a reluctance sometimes to treat a parent like a child.
Mm-hmm. And it can be overwhelming, and so all you're doing by the time you reach a certain point, I'm guessing, is just sort of surviving and treading water almost every day. Your whole life, I guess, kind of becomes caring for this person. And yet, is it important as the caregiver even to find a support group, somebody who you can go to say, I feel overwhelmed?
Absolutely. And Alzheimer's is such a common disease, affecting upwards of 15% of patients over the age of 70, or 15% of the population over the age of 70. The Alzheimer's organization has support groups and chapters in virtually any populated location.
Thanks for your time this morning.
All right, thank you.
Dr. Nathan Wyatt, you'll find him at Chattanooga Neurology Associates on Glenwood Drive at Memorial Hospital, Suite 467-698-3423, ChattanoogaNeurology.net. We're back after this.